So hi, hello everyone, welcome back to my channel. Today I am in front of you with a lengthy video after a very long time. Since I was busy with my own schedule in the college, I couldn't make out the long videos, so I'm apologizing for you that. The topic that today I'm discussing in front of you is acute bronchitis, which is also known as a silent cough, which you should not ignore. Have you ever experienced a cough which will never stop? You think it is a simple cold, but what if it is something more than that? So today, in this episode, I'm here to uncover the truth of acute bronchitis, where millions of people experience, but still they do not know about this completely. Straightly diving into the topic, let us discuss what is acute bronchitis. Simple. Acute bronchitis is the inflammation of bronchial tubes, where bronchioles are the passage where they carry the air to the lungs. But acute bronchitis is a infection or a disease infected by the same common virus which cause the disease of cold and flu. So what exactly is happening inside your body? To tell, the bronchial tubes get swollen, inflammation occurs, the production of mucus also extends inside the bronchial tubes, which causes you for a persistent cough, and the cough is produced with the mucus, or which we also call it as expectoration. Expectoration with cough is very much common in acute bronchitis. So coming to the symptoms of acute bronchitis, as I told you before, the main symptom is persistent cough with the mucus or expectoration, and chest discomfort, or the person is feeling the tightness in the lung region or the chest region. The person might feel shortness of breath, fatigue because there is no oxygen intake and no carbon dioxide exhalation, so the person might feel fatigue, and very mild fever or chills might be present in the patient. So when a particular patient is visiting a doctor with this kind of symptoms, while during the diagnosis, the doctor might hear crackling or wheezing sound in the chest region, where the doctor will keep the stethoscope and he might be checking here. He can hear the wheezing or the crackling sound in the chest due to the accumulation of mucus inside your lungs. Here is the main point where we need to observe. When the person is facing acute bronchitis, antibiotics doesn't give any kind of response. It is very rare case if the antibiotics is working for that particular patient. It is very much rare case because acute bronchitis is caused due to viral infections. So antibiotics doesn't fight viruses. It is mostly fighting on the bacterial growth or like all those other things, but antibiotics doesn't react or doesn't fight virus. Instead of focusing on the complete treatment of that particular disease, first stage we can focus on the relief of the symptoms. So how we can overcome the symptoms from the patients? First, we have to overcome the counter expectorations of the patient. We can give painkillers like ibuprofens, and also as a home remedy I would like to recommend honey and ginger tea. Who doesn't love natural cure? So, as I'm suggesting you, prevention is better than cure. So why don't you prevent yourself earlier? Go and get your flu shots. Wash your hands daily, before eating, after eating your meals, or if you touch any dusty area, don't touch your face. Don't always move your hands near your face. You don't know what you are inhaling. While if you're doing like this, if any dust particles are in your hand, you can inhale them. It may cause another type of infections for you in the breathing tract. And most seriously, I'm telling you, please stop smoking. if you are addicted for smoking and you are willing to stop smoke free and still you want to take the nicotine, please go ahead for nicotine replacement therapy. There are patches, there are chewing gums, and there is a particular video for that which you want to learn about how the nicotine replacement therapy works. You people can use them, but please don't smoke. It is very much irritation for your lungs. The cells will make deformation, and sometimes during the diagnosis doctors cannot understand which is the original cell and which is the damaged cell. That much injury will cause smoking to your lungs. So never, please, if you are a smoker, please then stop trying to smoke. You can go ahead with some other replacements if you are so much addicted. Otherwise, please control smoking. There are some myths that you have to come out of while thinking what is acute bronchitis. So acute bronchitis treatment doesn't always requires antibiotics. So people who are in the condition of acute bronchitis, they don't require antibiotics. And next, all the cough what you are facing, it is not because of bronchitis. It might be some allergens or any pollen, dust, anything which has entered your respiratory tract due to that, or any acid reflux in your gut. Due to that also sometimes cough will be caused. And most importantly, bronchitis is not the most severe case. The untreated bronchitis may lead to pneumonia, but acute bronchitis is not similar to pneumonia, since they both are the disease where it is related for the lungs. It doesn't mean that it is pneumonia. Pneumonia is where very much it is severe case. I will discuss it with you in the later videos. But acute bronchitis is not the severe case. You can reverse the disease if you are following a very healthy diet and you are very much conscious about your health. So, as a takeaway from acute bronchitis is not a harmful disease. It is curable if you hydrate, if you take rest, and if you avoid all the irritants which you were taking. It can be cured. It is not at all a big issue, but self-medications and unnecessary dealing with your body yourself will lead to complications. So if you have doubts or if you have symptoms, please consult your doctors, whomever you are comfortable with. Diagnose yourself once so that you will get to know what exactly your body. Thank you for joining me in the journey of the lungs, and I would like to tell you, if you like this video, give me a thumbs up and share it with your friends or family, whomever need to get this kind of informations. More the thing I want to share you with is, if you are just seeing the video, please support it, because we make a lot of effort to make these videos. I really require your support, and all the way you have supported me till now, I would require more like that. And at the end of the video, I would like to thank you so much. If you are new to my channel, please don't forget to like, share and subscribe, and I will see you in the next video. Stay healthy, stay informed.